as long as we're on the subject, here's a tip. As a manual therapist, whenever you can get the body to do the work for you, that's going to save you time and effort. And it's also going to save your hands in the long run. So get rid of that. Don't need that yet. Cartilage, that rib cartilage we've been going on nonstop about the last two videos, has a certain characteristic and a quality to it. Well, a few different qualities. This blue stuff I'm drawing here, the rib cartilage in this case. You could say the same thing about the ear and the nose, but yeah, mostly focused on the ribs right now. It is dependent on diffusion. It has a blood supply that runs, close to it, that, shoots off and this kind of thing. Intercostals, you've heard of them before, I'm sure. Anyways, it runs close to it, but it doesn't have a direct blood supply. So the vital nutrients getting to it, the vital nutrients like actually getting to the chondrocytes, the active cell of the tissue, has to rely on diffusion, whether that's like O2 or foodstuffs or whatever you want to call that, but it has to get in through passive mechanisms, which is very different than a pulse because it can deliver it directly to the tissue, and through a capillary there can actually be infiltration. It can get right directly to the cell, so there's some distance to be traveled here. So therefore, based on that, fluid motion in and around the area, that kind of wavy stuff, is essential to the health and life of the cartilage. And therefore, what we're really talking about, the mobility and flexibility that cartilage requires, two of its main attributes are totally intertwined with that. If the cartilage is poorly supplied, obviously it's going to become a little more rigid, a little more stuck, especially if it's been damaged previously. So if it's stuck, we need to get it moving again. We want those ribs moving and expanding, inhaling and exhaling, all of the above. It has to do all of that stuff. So we have to encourage that fluid motion somehow. And it turns out tissue movement, like, I don't know, maybe some muscles that I drew well in advance, maybe some muscles that I drew well in advance. But that will help significantly because it turns out the movement of muscles, so whether we're talking about, pec major, pec minor, and of course, we can throw in the other ones there too, all the way into the intercostals. And the serratus anterior, of course, is very important. But all of those, based on their shifting and around mobility in the area, they can encourage fluid movement on a lymphatic end and on a venous end. And if we can clear that out better, we make space for the arterial end, which will diffuse and become plasma, etc., etc. You get the idea. And this is down to the muscular sarcomere level. It's even down to the bone cells. So this is pretty significant, Tissue movement has a bigger effect than we often give it credit for. So how are we going to actually do that? Again, trying to save time, trying to save our effort always. Our motion is a simple answer because it's the most locally attached thing, and that's our motion. I'm going to say, abduction and what we call flexion, bringing it up that way. And hopefully, really get rid of those, we can combine that into one singular, very beautiful motion that we call circumduction, at whichever way you want to take it, forward or backwards. But it's important to do this circumduction motion, because as you take it one way, it will stretch, it will lengthen the tissue, it will bring it this way as we bring it up and out. But as we bring it the opposite way, it'll shorten that tissue. And we really do need both movements. As we stretch it, we squeeze it, we create one pressure to drive it out. And as we take it back into a relaxed position, the opposite end of the movement, we get a refilling of fluid to then be pumped out again. So the mobility of this arm, as we change that, as we start circling it around and around and around many times, and in fact, as we just get it moving better when the person's walking around, when they're breathing, when they're normally doing stuff, just scapular motion alone, just get this guy in back here, get that going, you're going to improve the fluid and therefore the health of that cartilage tissue for that person. Now, another thing that's really important, cartilage is actually slow to adapt, and it should be. Consider what we have underneath there. Turns out there's a whole heart, approximately there, and a lung or two in fact, two lungs, nice cardiac notch in there. two lungs, one on either side. And if your cartilage moved a lot, if you could, just flex that whole thing in, oof, you'd be collapsing your heart and lungs constantly. So cartilage should be slow. So it's very beneficial that we get these tissues here, we get them moving slowly and gradually, and we take that arm into a same equally slow and gradual range of motion increase, mobility increase, proper muscles firing. These are very important things to ensure that it's not too fast. Too fast is the opposite of what we want. You could move the cartilage one time really fast with a hammer, but I don't think they'd be in a state to come back and see you ever again, and perhaps anyone ever again. So, don't do that. So, anyways, important point. As this arm moves better and better, it will help normalize the cartilage. It will help bring it back to what's close enough to normal. It will bring it back to a healthy state. And eventually, what we hope is that that person doesn't really need to see us anymore. They can, through mobilizing their own tissue, through their body moving normally, sustain what is normal, that supple state, that mobile state of that cartilage. But here's another thing, though. If the arm can be used to fix the ribs, that's what it was supposed to be doing all along anyways. Almost like they work together. Ha.